Medicare open enrollment may be over, but the questions don't stop there. From life changes to special enrollment periods, there are still ways some people can review or adjust their coverage throughout the year. Joining us from Verda Health Plan of Texas are Dorothy Chan and Jonathan Lemus. Good morning.
Good morning. Thank you for having us.
All right. First of all, let's clarify because people always get this mixed up. Somebody just told me the other day, no, I think it's the same. No, Medicare is not Medicaid.
Correct. Medicare is a federal program who is covered for people who is 65 and over or certain disability. It's based on work history, age, but not income.
Yeah.
So Medicare, it's covered for Part A, hospital, Part B for the doctor's visits, Part D, it's prescription drugs plan. Yeah. So Part C is actually us, Verda Health Plan of Texas, Medicare Advantage plan.
All right, so this what you just said explains why it's great to have an expert to sit with you, because there are several moving parts to this, and it all depends on what your health needs are, right?
Right.
All right. Annual open enrollment. We know that happens, and we saw y'all on the show before. That's the period that's open in general for people to do things, right?
Yeah, correct.
Yeah, and right now there's if someone's turning 65, they can always look into comparing their plans, or if they have a chronic special need, maybe they develop diabetes over the off season and they need to look at their plan.
Okay, so I'm gonna pause right there because normally it's like about mid-October to early December is when the open enrollment period is, right? And then people will say, okay, if you don't get in between then, you got to wait till the whole next year of open enrollment. Yeah. But there are people who have asked the question, but wait, I'm not 65 yet, but I will turn 65. So at that moment, you can come into the program.
That's correct. They have 7 months. They have the 3 months before the month of their birthday, the month of their birthday, and then 3 months after. And at any time in that window, they could give us a call so we could review their options and point them in the right direction because it could be complicated.
Yeah. And then the point you just made, if your health changed drastically, not if you're going to maybe switch just a prescription or something, but if something really happened that impact your health, then that's when you would come to you all and come in, and then you can come into the program.
Absolutely, because if you developed a chronic condition like diabetes or a chronic heart condition, it might be a good time to compare your plan and find a plan that fits that special need.
Yeah, because that can change everything, right?
Yes.
All right, Verda Health Plan of Texas. Why was this particular health plan formed, and who do you address in particular?
Yeah, so Verda Health Plan of Texas is a very cultural, ethnicity sensitive health plan. So we cater to people who underserved, who speak a second language, and we're here to assist them.
Yeah, because actually when you explain this program, it can sound like in a whole new language of its own for anyone, right? But yeah, that way to make sure there's no missteps, and you all have people who are well versed in various languages, right?
Correct. We do have staff members who speak different languages at our local resources center. Like you mentioned before, healthcare can be very confusing. Not everybody is comfortable to do anything online or over the phone. So,
and by the way, that cuts down. In fact, there's a big news story out of California right now where there's a lot of fraud taking place. And so in this case here, you have real people that you can talk to, and that you can sit down and go over things with them. You also make it just not just all about the prescriptions and doctor visits. You have resource centers available.
Yes, our member resource center is open Monday through Friday, and members can come by and get information on healthy food items. They could do Tai Chi classes. We do dance classes. We want to keep it active, and we want them to have a good time and also get the information that they need, because member experience, which is our customer service, is available in person if they have questions. So they don't have to wait over the phone and call over. They can come see us in person and get their questions answered.
Yeah, and some of the other things they can do, because you want seniors getting social. We know that keeping seniors social oftentimes can extend quality of life, right? Yes. Game nights, painting classes, tea parties, karaoke, birthday celebrations, dancing classes. Do I have to wait till I'm 65? Can I just come by?
Absolutely.
All right. But yeah, you can also bring a +1 there. So what does a visit look like with you all? And again, specifically, who should come in? Obviously, somebody who's turned 65 recently, and then somebody who has a big change in their health care.
If they have any questions about their current Medicare plan, or if they want to just come by to look at the resource center, or maybe their neighbor or their friend said, "Hey, come with me. I want to show you this member resource center for Verda." So it's in a great location, Southwest Houston, and if they're getting some groceries, they can come right up and see us at any time.
Yeah.
So it's very helpful. Now, currently we're in Harris County, Fort Bend, and Montgomery County here locally, and we just expanded into Dallas County and Collin County as well.
Yeah, and don't wait, don't put it off. It's so easy to put things off, right? Don't put it off, especially if you had a big change in your health.
Exactly. We welcome everyone to come by.
All right.
See us.
Thank you two very much.
Thank you.
All right, Verda Health Plan of Texas has multilingual representatives, as we mentioned, ready to take your call right now. You can call them at this number, 877-419-2730. Again, that number is 877-419-2730. Get the ball rolling, or you can visit them online at verdahptx.com, verdahptx.com.